Before Hannah, we'll have James Shearman. Some of you may know him already. He's Head of Innovation at Impact on Urban Health, and we're hoping that he can share some insights with us about the differences between participation and extraction, why good intentions are breaking community trust.
Tough act to follow, and a lot of it resonates with my perceptions and experiences of working on the institutional side, which I'll come on to. But I did just want to say thank you to Sedulous for organising this event, and thank you to all of you for being here and giving up your time as well for what is a very important topic. And it's one I've reflected on quite a bit as to whether or not I'm even the right person to be sitting here and talking to you about participation fatigue. And that is something that I think it's kind of gone full circle for me and being reassured that there is value in the institutional perspective within this. But it is also institutions such as mine and many others that are at the root cause of why we're here today talking about this. For a bit of background on myself and our organisation, I work for Impact on Urban Health. We're an urban health foundation based here in Lambeth and Southwark. And at our core, we're wanting to collaborate with partners, and we want to learn what works, and we want to share and get those ideas to as many people as possible to build health equity in Lambeth and Southwark and beyond. We have a strong focus on the intersection of kind of health, poverty, class and race. And my team specifically within innovation is focused on improving our practice as a funder, and that's where community research plays such a vital role for us. 4 years ago we entered into a partnership with Welcome Trust, one of the largest foundations in the UK, to explore power essentially and look into the very things that Arel was talking about around shifting power and how you do that in a meaningful way. From a research perspective, but also from a funding perspective, which speaks to kind of some of the participatory approaches that Arel has mentioned. And some of that has kind of fed directly into where we find ourselves today. Because hearing Arel speak, we didn't plan this or coordinate in any way, but some of the things rang incredibly true, like ticking learning boxes, for example. We wanted to learn about how to improve the way that we utilise community research. We wanted to understand what was needed to support a thriving ecosystem within Lambeth and Southwark that would enable and empower people on the ground to feel like they had agency over the solutions that come from community research. And we also wanted to understand how we as an organisation could do more to engage with and communicate with communities. And we've been on quite a long journey over that period. We've not got everything right by any stretch of the imagination, but we have improved quite significantly over that time. And one of the things that we're doing that we're probably most proud of is, to Arel's point about getting people in the room, we're in the process of recruiting community members and community leaders onto our urban health committee and our investment committee, so they have that strategic oversight and strategic oversight over both what we do and how much we spend on it. And from an institutional perspective, that has taken 2 years of work to give you a sense of the scale of change and the pace that these institutions such as mine move at. It is incredibly difficult, even working with all the best will in the world, to get them to shift. But it is possible, and you do need to keep moving at it. We have a kind of understanding within our perspective of community research, which has kind of 3 levels to it, which we see. The first level is kind of understanding and gathering insights, and this is where that extractive element, I think, comes in quite strongly. And you need to be very mindful of kind of why you're gathering that information and what you're trying to understand and for what purpose. The second level, which is around dissemination and ensuring you're sharing those insights with communities in ways that are accessible for people who have worked on it. And the third level, which I think Arel's spoken really powerfully to, is actually about creating new institutions, new knowledge spaces, and mobilising organisations that are on the ground doing this work to allow them to take the control over enacting systems change and changes they want to see in their communities. And on that kind of I guess, 4-year journey that we've been on, I've got probably three takeaways, three learnings that I'll share with you today. And I think one actually dovetails perfectly with the Rails perspective, is that you have to have a plan for where that research is going. And it's not just the research, we're going to do this research and then we're going to go and put it here. It's like, you've got to take it step by step as to, we're going to do this, and then how are you going to involve the people who have answered your survey, answered your questions, in then coming along to be part of those conversations in those rooms with local authorities, with institutions like mine, with other larger institutions. And what does that look like? What do those people need then to be able to be funded and supported and built, so you can build their capacity to do that? Because if you don't do that and you don't enter in that way, you'll end up extracting in any way you do it, other than that way of trying to really meaningfully think deeply and long term about what your goals are for what you want to happen. Second part of that, and one that I'll give an example of, is we've done some really good work in one of our health programs around the health effects of air pollution, and we have a whole strand of work which is called Amplifying Voices, and the purpose of that is purely to invest in organisations on the ground that are closest to the problem, to allow them to advocate and be in the right rooms to make the right decisions to ensure that people can breathe clean air in their communities. And it's, for us, it's been kind of the blueprint for how we would want to engage in community engagement and community research moving forward. Secondly, communication is really vitally important. We've made the misstep many times where we don't close feedback loops, and it does an enormous amount of harm to communities. We, for the first 3 years of the project I mentioned around shifting the power, we didn't talk about it once. It wasn't on our website, people didn't know it was even happening. And when you create a vacuum like that for communities that have seen, they've been part of the work, and then they're not represented in any way, it does a lot of harm, and people can't see what their work has gone towards. And we're starting to rectify that now, but that was a big mistake on our part. We've recognised that now, and we're looking at how you can change our communication strategy so we're not just this B2B influencer. We're looking at ways that we can be more accessible and more inclusive in the way that we communicate, so we can close those feedback loops in a more intentional way. And finally, the how is like as important as the what, and if you don't enter with care, you will not be able to leave with care, and that means that you have to be so to the point around the plan. You have to enter that with the right care, the right kindness, and the right humility to understand where this is going. And so when those kind of avenues for whether work is coming to an end or whether there's future advocacy work that comes off the back of it, or the solutions happen, there's mutual trust and agency there that allows for a much healthier and much better representation when you get into those spaces. I'll leave it there, but yeah, thank you again for the opportunity to speak.